Hey YouTube, how you doing? It's me again. And I feel so much better. I look so much better. My face is not swollen like it was. Like this side has completely gone down, but of course this side is still swollen. This is the side that the incision that busted is on. And as a matter of fact, I have an update on the incision and on that side. The incision on this side is still open, and actually it has gotten bigger. So I'm gonna have to go back to the surgeon this week, and they're gonna have to re-sew it closed. That's gonna be a lot of fun. This is week 2. I'm nearing week 2 of this process. Again, this is a 6-week process. Where I'm gonna have my teeth wired shut. The last time that I did this video, it shut off on me, and I was starting to say, when you have a surgery like this done, you want to make sure that you have somebody helping you. Thankfully for me, I have my partner who pretty much makes all of my food, crushes all of my pills, and hi baby, he crushes all of my pills because again my mouth is shut, so there's no drinking of any, like, no eating or chewing of any kind. Everything that goes in your mouth absolutely has to be liquid. No chunks, trust me, they will get stuck. Even like little strawberry chunks will get caught in the water, and it's so frustrating. So everything, your diet is pretty much going to be protein shakes and juice and water and like finely pureed soups and stuff like that. So yeah, that's pretty much where I am with the whole diet thing. If there are some tips that I have learned so far, it would be those scissor thingies. Wear those all the time. 2, get you a really, really good peel crusher. Not a cutter. A crusher. Go on Amazon and find you a peel crusher. I will show you what mine looks like right now, but my partner is currently crushing my peels with it. I'll show you what it looks like the next time I update the video. A pill crusher. And you also want to make sure that you have really big straws. Go to, your local grocery store. Don't get the regular size straws. Get the really thick straws. You'll find that those are going to come really, and they're going to be really handy when it comes to drinking shakes and your really fine pureed soups, because they can't go through regular straws. Make sure when you first have the surgery done, for the first week, because of all of the swelling, make sure you sleep with your head propped up. Yes, prop up. Also, make sure that you, at the hospital, that they give you one of those things that you saw me wearing in one of those videos. I think I was wearing like the first video. And it kind of cups your head. It's like a band that goes around your head, and it has pockets for you to stick ice in. Those are lifesavers. It keeps the swelling down on your cheeks. So make sure you have one of those. Let's see, what else can I tell you? Make sure that you take your medicine on the hour, every hour that you're supposed to, because if your painkillers run out, you will know, and it is horrible. It's horrible pain. So just make sure you're taking the medicine like you're supposed to. Oh, one more thing. Constipation. you will be taking really strong meds like Percocets and stuff. I love you too, baby. You'll be taking stuff like Percocets. Percocets make you constipated. Make sure that you have like some magnesium on hand, or you are taking Colace and breaking it up and putting it in your juice, or some Marilex or something, because you will be constipated. For the first week, I did not go to the bathroom. And when I did go, it was so hard to go. Man. So, you don't want to be constipated. That causes all kinds of other issues that will have you in the hospital for no reason. So, make sure you drink, lots of fluid. That's another thing. Your mouth will always be dry. I don't know why. It seems like with your mouth being closed that you would be able to keep more moisture in your mouth, but that's not the case. Your mouth will always be dry, especially if you're brushing your teeth like you should and using the mouthwash that they give you to keep the bacteria count down in your mouth. Your mouth will always be dry. You'll be drinking water like crazy, so always keep water on hand. At this point, that's pretty much all that I've learned. Having my mouth shut, like wired, it's actually not that bad for me. For some people, I hear they get anxiety from having a mouth shut, but I mean, it's not that bad. The only bad part is not being able to chew food for too much, because I like food. But anyway. So that's my update. I feel better. I look better. My swelling has gone down. This is the end of week. This is what, Tuesday? So I am in week number 2. I am not at the end of week number 2. So yeah, it's going well. If you have any comments, any questions, make sure that you post them at the bottom, and I'll be sure to answer any questions that you might have. Thank you for watching, and I will see you next time on my next update.